Hi, Brigida Schmida here. Today I present for you a meta-analysis and systematic review of risk factors for shunt dependency after subarachnoidal hemorrhage. This article was published in 2017 in Journal of Neurosurgery by Dr. Wilson. Okay, so here is a typical image of rupturing of a brain aneurysm. So the hydrocephalus after subarachnoidal hemorrhage can occur till 60% after the subarachnoidal hemorrhage, and this is the typical brain CT when we can see a ventricular enlargement after subarachnoidal hemorrhage that we can treat with placement of a shunt that can be external or ventriculoperitoneal one. So the ventriculoperitoneal one is that one that can stay after many years for and indicating the dependency of a shunt for this kind of patients. So here we will analyze the risk factors for this shunt dependency after this brain hemorrhage, okay? Till this study, so the factors that predict this shunt dependency were not so clear. So the study questions were to identify or publish risk factors for shunt dependency in the subarachnoidal hemorrhage patients, the magnitude of each risk factors, and also to organize literature according the level of evidence. So search strategy was to search in Medline and PubMed articles that pertaining with hydrocephalus, subarachnoidal hemorrhage, and shunt dependency that were published till 31 December of 2014. They searched for title and abstract with the terms aneurysm, subarachnoidal hemorrhage, and shunt dependency combined with ventricular peritoneal shunt, Barker-Dowd index, shunt dependency, risk factors, neurological grade, Glasgow Coma Scale, Hunt-Hawes score, the Fisher grade, and the World Federation Society grade. Also, age and sex. So, the selection of studies, they included grade criteria, and at the end of the studies, they selected 21 papers. For sensitivity analysis, they compare Fisher grade 3 and 4 versus 1 and 2, and they found heterogeneity of near 70%, which can be classified as a substantial heterogeneity, and they found an overall outcome like near 80 times risk factors to have a Fisher grade 3 and 4 compared to having a Fisher grade 2 and 1 for shunt dependency. And here we can see that the articles included were similar in weight, but here we found that these DORADs of 2003 were 13% of weight. So here we can find that this sensitivity analysis had a good prediction for risk factors after subarachnoidal hemorrhage for shunt dependency. And how about the acute hydrocephalus or no hydrocephalus at presentation? So here we found an overall outcome near 6 times for the presence of shunt dependency after presentation of acute hydrocephalus versus no hydrocephalus. So here we also found that these articles have good or substantial heterogeneity also. Okay, so and for the complications here, they included meningitis, pneumonia, vasospasm, ischemic stroke, or no complications. The meningitis is the nosocomial meningitis after placement of external shunt, okay? So the heterogeneity here is also substantial, but unfortunately here we have just a few papers to compare, but also here we found an overall outcome that is positive for shunt dependency, comparing complications versus no complications of these patients. At the end we have here a positive effect of a positive risk factor for shunt dependency if the patients have complications versus no complications during the hospitalization. Okay. Talking about the presence of interventricular blood versus no interventricular blood on presentation, we can see that for the overall outcome is nearly 4 times increasing the risk factors for the presence of a definitive shunt for this kind of patients. And also we can see that heterogeneity here is almost 70%, which is also substantial heterogeneity. Okay, so here comparing the Hunt-Hess scale, high versus low Hunt-Hess scale, so that patients that were in a better situation compared with this one that they are in a good situation. We have that these patients that have a high Hunt-Hess scale, also the prediction of being dependent of shunt are increasing by 3 times comparing with these patients that have lower high Hunt-Hess scales. Okay, but here the heterogeneity here for this patient is like a moderate heterogeneity. Almost this heterogeneity might be not so important, so here we have to pay attention. Okay, guys. But at the end, the paper shows us that this Hunt-Hess scale may be a positive factor prediction for shunt dependency. Okay, and about the hemorrhage detected on brain imaging and hemorrhage, also here we have a positive risk factors for shunt dependency, but the articles included here were just a few articles. So here maybe we have to pay attention for this hemorrhage detected on brain CT. Okay, and comparing the posterior circulation aneurysm location versus anterior location, here we can find almost near 2 times of risk factors for a shunt dependency after the rupturing of this aneurysm, and also here we can find a good heterogeneity level. Okay, guys, and talking about these patients that are older than 60, also we can find these same 2 times risk factors for the shunt dependency. But here again, I said for you that maybe this heterogeneity uh, could be not so important here to predict that patients that are older could be shunt dependent after subarachnoidal hemorrhage. Okay. And about the shunt dependency here, the authors didn't find that female sex were a good predictor factors for being shunt dependent after a subarachnoidal hemorrhage. So here the publication bias assessment was done by funnel plot construction, but the funnel plot were not available as supplemental figure. The link that authors provided was not working. So unfortunately, no additional information regarding publication bias were assets by this here I had performed some considerations, so the research question was not clear. The funnel plots for the bias assessment were not included in main article, so we can perform this bias assessment and reproduce this bias assessment the authors did. The subgroup analyses were also not so explored to justify the heterogeneity between the studies, and for considering the age, the fixed model effect was used here. So also for age, we can have a higher level of bias here for considering age like being a positive factors for shunt dependency. Okay, so guys, thank you so much for listening me today. See you. Bye bye.